will I need to temporarily wear glasses after RLE surgery? Um, it depends on what kind of implantation or lens we put into your eyes. So if you did a multifocal lens and we're on target, I would expect the day after surgery you're seeing near and far, or greater than 80% of the way to your ultimate vision with these lenses by just the day after surgery. Some people feel like they're 100% there, but I would say at least 80% of the way. Now, if you did another type of lens, let's say the light adjustable lens, it's a different procedure. After surgery, you may have good distance vision, but it's not until 3 to 5 months later after the adjustments with that lens that we're able to then restore and program in that range of vision for you. So during the adjustment period before these lenses, light adjustable lenses, are locked in, you're expected to wear UV blocking glasses. They can be clear or dark glasses depending on the outside conditions. And these glasses block the ambient UV light, which generally just comes from the sun. So you would typically just wear these outdoors. Indoors, there's usually no UV light sources, except maybe in tanning salons. A patient once asked me about mood lights, and I think that was a really good question. And I didn't expect mood lights would have a UV light source, but they do. But it's there's UVA, UVB, UVC, and it just so happens the mood light, like a black light, isn't really on the spectrum that would affect your light adjustable lens. But we made the patient wear the UV blocking glasses from RX side anyways, just because she had the concern and we didn't really know the answer and didn't feel confident that wasn't going to affect her outcome. So we made her wear her UV light with her mood light, or the SAD lamp, seasonal affective disorder lamp. Sorry, let me just see what the question was again. Glasses after surgery. Another situation where we may encourage you to wear glasses is if we're slightly off target. Now, when the multifocal lenses are right on target, you should be seeing near and far, unaided. If you're slightly off target, let's say you're a little bit more farsighted in the outcome, and that happens in maybe 1 in 20 or 1 in 40 patients because of the unpredictable nature of the effective lens position as the lens is settling in. Then you may want to wear some reading glasses to just help you get through that period of adaptation until things kind of go back and resolve on their own, or we take action and do a intraocular lens exchange, like repower the lens to get you even better vision, or do a little LASIK surgery to get you the rest of the way. But we typically don't want to act too soon with that, because as things change, you could be just kind of chasing your tail, and that ends up with an overcorrection or undercorrection ultimately. We want to wait at least 3 months before, and through several measurements that everything's stable before we proceed with a second surgery to make things even better for you. Let's see, and then the opposite is always true as well. You may come out a little more nearsighted, and if a little more nearsighted, we can temporarily give you contact lenses or temporary glasses to aid your vision until things are stable enough for us to update the lenses inside your eyes to account for being off target, or do a little LASIK surgery as we discussed. So hope that helps.